All right, this is Dr. Michael Watson from Arizona Jaw Surgery, making another video. I'm trying to help educate the jaw surgery and TMJ surgery public at large about some of the myths in TMJ and jaw surgery and some of the common questions that we get that we feel like I think we explain over and over again. And so maybe this will be helpful for educational purposes. So, a very hot topic in orthognathic jaw surgery is custom hardware and its use, its affordability, its viability, and its accuracy and benefits essentially. So there are some pros and cons to this, and I want to go through this because sometimes it's conceptually a little bit difficult to follow and understand. So when we start talking about custom hardware, there are of course pros and cons, and we want to kind of go through those with you. So some of those are really involving intricacies of it that you as a layperson or as a potential jaw surgery patient may not quite understand or grasp. One of the most important concepts of this is that it does in fact cost more, usually anywhere from $6,000 to $20,000 more. But because it's buried in hospital bills and EOBs from insurance companies, the patient doesn't always notice this. They just get their hospital bill or their insurance balance, and they look through what are pages and pages of what looks like nonsense, and they don't really grasp that they're paying more for this hardware, but you are in fact paying more for the hardware, sometimes up to $20,000 more. It's also more likely to be removed. In a recent paper in the Journal of Oral and Maxillofacial Surgery, there was a corrected outcome difference of about 8 times more likely to be removed than stock hardware. So not only did you pay for the cost to have it put in, now you're more likely to pay for the cost to remove it, which is also more difficult to do than to remove stock hardware. Stock hardware can usually be removed in the clinic under local anesthetic or IV sedation. You can try that with custom hardware, but sometimes it's more difficult. And so now you're paying for another general anesthetic and more involved hardware removal. To place these, you also have to do more tissue dissection, which causes more soft tissue trauma and edema, swelling. And one of the touted benefits of this is that it causes less swelling. And I don't know that that's a reality. The last fact is possibly the one that's most difficult to understand, and it's involving accuracy of custom hardware. It's touted as being more accurate than stock hardware. We get a more accurate outcome. So you as a patient, there's a couple things you should know about that. One is most of those studies were done in university type settings where there's residents or younger surgeons doing the surgery. And for custom hardware, that is more likely to be beneficial in less experienced surgeons, with the difference being somewhat negligible in more experienced surgeons. The other thing about accuracy that we'll get into is that it's accurate to the plan. But any good jaw surgeon knows there's not always perfection in the plan. And so you are married to the plan with custom hardware. So what if the records appointment, you weren't biting in your normal bite? What if photos were a little bit inaccurate? What if you were not smiling or moving or talking quite as well as you normally would, or the same way you always would? Then the records and the perception of where things are can be inaccurate. And when you plan to an inaccurate position with custom hardware, you're stuck to that. Like, the hardware goes where the hardware goes. Whereas if we were to see an inaccuracy with using stock hardware, you can change it in real time. Oh, it looks like our midline's off. Well, let's move it over a little bit and correct it. You can't do that with custom hardware. You have to essentially throw it out and do stock hardware, and now you've paid for both. Or you stick to the plan and you have inaccuracies built into the plan. So the accuracy is to the plan. And even there, the differences in experienced surgeons is negligible. But in some ways, I know it sounds counterintuitive, you want a little flexibility in real time to be able to make changes to the actual situation instead of what you saw on a records appointment. So the other aspect of this is marketing and reality. Some of these concepts just sound ideal, but they're not. And you don't find out as the patient until after the fact, because neither is inherently right or wrong. And those of us that do both, I think, allow you as the patient that flexibility to get a good result using either method when either is more appropriate. And that's how I think we should be approaching this. Is custom hardware is a tool in the toolkit. It's something that we can use when we need to, but we shouldn't rely on it. We shouldn't just plan on every patient needing it, because we're not only increasing the cost for each individual patient, we're also contributing to the overall healthcare cost of like a community aspect or a global aspect. And that's going to affect insurance reimbursement, hospital viability. So there are grand, kind of bigger picture things that come along with this. The other thing I would mention is think about the touted benefits of custom hardware. And do you really want those being the focus of your surgery and your surgeon? Do you want your surgeon to be focused on how fast they can do the surgery? Oh, with custom hardware, I can just go in there and haphazardly operate, stick some hardware on there, and it works. Well, you've got nerves in the field, you've got aesthetic issues, you've got occlusal issues, midline discrepancies. Like, I don't want someone rushing through my surgery. I know what's involved in this, and I want them taking their time around my nerves. I want the last thing on their mind to be the speed. I want a good outcome with fewer complications and long-term implications like numbness or poor aesthetics. So breaking this down kind of step by step or benefit by benefit, let's compare what's real and not real. So custom hardware increases the accuracy of the surgery. Again, we talked about what actually is the accuracy. That doesn't mean you getting the ideal outcome. That means comparing it to the plan, it gets a little bit closer to the plan, again, mostly in inexperienced surgeons. So you might get half a millimeter or so to the closer to the exact planned position. That doesn't mean you got the ideal position. And that's, again, one of the benefits that seems counterintuitive to stock hardware is changes in real time can be made. And if it looks like things were planned wrong, if it looks like the records were wrong, and you notice it in real time, you can make that change. You can't do that in custom hardware. So custom hardware decreases surgical time, decreases swelling. Again, do you want your surgeon trying to go as fast as possible? I don't know that you do. And I would also add that the time and swelling difference between the two is minimal. Most experienced surgeons who use stock hardware are making smaller incisions than you would need with custom hardware. The time difference is going to be minimal. I don't know that you would be able to pick out the same surgeon who does both and who is experienced. I don't think you could tell which patient had custom and stock hardware based off the swelling and recovery. And then the last one is that custom hardware is more stable. This is true. I guess actually the way I would word it is it's more rigid. That's good and bad. Again, once you get a certain level of stability, anything in excess of that is unnecessary. And so it's not like we're not using stable fixation hardware with stock hardware. And now you've got a more rigid, larger construct with this custom hardware. And if it needs to be removed, which we've shown you is 8 times more likely, it's a much more involved process. So the cost goes up. It's more likely to need a second procedure. So it's not all that it's cracked up to be in a lot of these regards. Again, what are we talking about? The plan is the plan. There's no changing it. If the records were wrong, what if the plan was wrong? You're stuck to it. You got to dissect further. Got to remove it nearly 8 times more likely to be removed than stock hardware, more challenging to do so, cost significantly higher. Those would be kind of take-home points of custom hardware that I'd want you to realize. And then lastly, what do I think you should look for? As someone who uses both custom and stock hardware, has been involved in jaw surgery for over a decade, I would tell you to try to avoid the gimmicks and the sales pitches, the marketing. It's not that those things that are touted are inherently good or bad, but like if you need a gimmick or you have to lean on something so heavily, it does decrease your flexibility. And what that means for you is that your surgeon may have fewer tools in the toolkit. And so that has the negative implication of you have to get what that surgeon can do within their limitations. And so essentially you get what we would prefer you to get what you need and not, quote unquote, be forced to tell you that you need what you get, so to speak. So I think that's something you want to be aware of. You want to be aware of absolutes. Hey, I always do this. I never do that. My patients always do well. My patients never have complications. You should realize that we all get complications. We all have issues. And anyone trying to tell you that they don't is probably someone you should avoid. And again, I would avoid speed as the main criteria for success. Again, I don't want my surgeon going quickly. I want my surgeon to do it right. Like accuracy, complications, numbness, these occlusion, midlines, these are the criteria we should be looking at. Because what if your surgeon went fast, but all those other things are much worse? I don't think any of us would want that or view that as a success. And kind of going along with that, you don't want the one size fits all. Strangely, the people who tout custom hardware often plan all their patients essentially the same. Like, I don't think you want custom hardware. I think you want a custom plan specific to you, your bite, your occlusion, your anatomy, your aesthetics, and not just another number on the list of everyone kind of gets the same thing. We use the same plan for everybody. I don't think you really want that. And with the gimmicks, you do have to be careful, because those of us that do a lot of this, we clean up after a lot of the gimmicks, and we'll tell you it's not necessarily what you want. And I know that's a hard concept to grasp, and sometimes sounds self-serving, but I do think you want to be aware of that, that some of these things are more marketing than true benefit. And then lastly, I think you want your surgeon to be honest. We all get complications. Anyone who tells you you don't, probably want to avoid. Ask about how they do things, ask about their techniques. Most of us, again, use custom hardware when we feel like it has a benefit or is needed, but using it all the time, again, kind of puts you in a box and means your surgeon may have some limitations. And then what do you do when you need something else? Or what do you do when the plan goes awry? Or what do you do when you have a complication? That surgeon may not be as equipped to deal with that in real time to your benefit. So that's just my take. Again, just my opinion. Dr. Michael Wasson, Arizona Jaw Surgery. Thanks for your time. I hope that was helpful, and look forward to talking with many of you in the future. Thanks.